Hi, I'm Jeff. I live in Palm Beach County, Florida. I've lived here for about 33 years, and except for going to college in Gainesville and a summer working in North Carolina, I've lived my whole life in Southeast Florida. So in December of 2015, I started to get sciatica in my right leg. And for the following year, we treated it as you normally would, less aggressively with anti-inflammatories, physical therapy, eventually 4 epidural injections. The pain kept getting worse. Then I was diagnosed with some issues with my discs down at L4, L5, and that a 2-level spinal fusion was appropriate. I went ahead and did that. Unfortunately, the pain didn't go away. And then they did a CT and they saw that there was a mass by my sacrum that shouldn't be there. So we did a PET scan. We did a biopsy here at my local hospital. They said that it was a leiomyoma, just a fibroid, which was non-malignant. They said, don't worry about it. But when I went for my 4-month checkup down at University of Miami with the specialist, and sure enough, he determined that it was instead a leiomyosarcoma, which is a rare cancer. It's aggressive. And that's why the local hospital probably never even sees these things. They're so rare. So I immediately went into surgery to remove the tumor along with my right internal iliac artery and vein. That was followed by the recommended chemotherapy, so 3 months of that. Then I did radiation with 25 sessions of that, the same as a pre-surgical 50 gray radiation. Then they decided that maybe it would be a good idea for them to actually go into the S1 foramen where their cancer started and ream that out and take out the S1 nerve just to be sure there's nothing hiding in there. But they couldn't get in there the second time due to scar tissue. So they closed me up and said, let's give them 30 gray more radiation. Hopefully that'll kill everything in that area. So we did that in February 2018. I was NED, no evidence of disease, good to be NED. I went along quite well for about a year, got back into my activities. But then in mid-2019, I started to get leg pains again. They saw a mass that wasn't really lighting up, so we thought it was scar tissue. So I went through ways to try and soften the scar tissue. Some medication that I took for over a year, that didn't seem to work, still had the pain. So I went to the second level of trying to treat that as a hyperbaric oxygen chamber. So I did 40 sessions of that, 100 hours total in a tube, sometimes with a lot of pain while I'm in there. That didn't help. I had about a year seeing additional specialists. I had injections to reduce painful spasms. I did have a biopsy in April of 2021 where we confirmed a grade 2 leiomyosarcoma recurrence. So I did 3 more cycles of a different chemotherapy. Then in August, I had a major surgery, and that's where they removed the tumor, part of my sacrum, my S1 nerve down my leg, and they fused me L3 to pelvis. And then that was followed by several more surgeries to repair cerebral spinal fluid leaks, which happened because the tissue is fragile from that high dose radiation that I had earlier. And that was the better part of 10 weeks in the hospital. It was quite traumatic. I had gotten a spinal infection while I was in the hospital, which was horrible. I don't even remember those days in the hospital. I was hallucinating, screaming. They had to do emergency surgery in the middle of the night. I looked in my hospital notes and they took me to an MRI at 1:30 in the morning. And they said they had to sedate me because the patient was in, intractable pain. For weeks, I had a lumbar drain, a tube coming out the middle of my back, which went to a device where every hour the nurse would drain milliliters of fluid out of my spine to keep the pressure low so I didn't spring another leak. The last leak I had was actually on the front of my spine. I'm not sure why that was there. They couldn't get to it to fix it, so they just shoved fat in there to plug it up. Thankfully, that worked, but it was quite an adventure there. And eventually, the surgeon said that my case is not in the books. He said, for my case with the fragile tissue down there from radiation, we've already kept you on this more than twice as long as the typical patient. So he said, we're just guessing, and hopefully when we stop it, it won't spring a leak. So I got out November 16th of 2021 and worked on recovery. I was on a walker. Eventually I could go one house, and then I could do two houses on the sidewalk, and eventually I could make it around the block. I got up to walking 2 miles, eventually riding my bicycle. But just 5 months out of that major surgery, they did my first real scan and said that I had a recurrence already. And that was crushing. So I did 2 cycles of chemo then. They rescanned and they said there's no obvious sign of disease, but high probability of another recurrence. About 6 months after that, they did another scan and said that there was a recurrence. So now I've been 6 weeks on Votrient, which is a targeted therapy, tries to starve the tumor of blood flow. Fortunately, that causes you to have high blood pressure, so I'm on 2 medications for that. It throws my thyroid out of whack, so I'm on thyroid medication now. So take about 26 pills a day with all the various pain medications, Celebrex, Tylenol, pregabalin, Cymbalta, 2 blood pressure medication, Votrient, vitamins, calcium, since I had all the surgeries on my bones. Hopefully this will keep me stable, the Votrient. It's not going to cure anything. If you look at the stats, Votrient provides stability for an average of 5.5 months, and then it stops working, and then you need the next drug. We already know the next drug will likely be trabectedin, which lasts a little longer, but I'll have to get another port in my chest, a pheresis port. I already have a double power port here from my other chemos. And then after that, we'll look at the same chemos that I've been on, circle back around to those, or look at clinical trials. There's hope in those areas. All right, in summary, I've had a lot of pain, continue to have pain. I'm unable to hold a job. I just reached 2 years of disability. And so at the end of this month will be my last day with my employer, where I've worked over 35 years. So that's emotional. I walk with a cane now because of the weak muscles in my hips. I can no longer walk for exercise or enjoyment, let alone hiking, which I like to do. Until recently, I was able to ride my bike quite well. So I'm down to only about 2 miles a day bicycle. I can't fish the beach like I used to. I used to chase the fish down the beach, run to where the fish are. Now I go down there with 1 rod instead of 5 or 6 and just fish in that spot, and the fish have to come to me now. And maybe it's chemo brain like they talk about, but I can't concentrate as well as I used to. Socializing is more challenging. Sitting for long periods tends to aggravate my pain. So sitting at the computer, or whether it be on a flight, traveling somewhere on a plane or automobile, all those things become more difficult. And I still do a lot of photography. I take a lot of sunlight photos, and I still get out there and exercise as much as I can. I want to hold on to my fishing, photography, and cycling as long as I can. So I think it's very important that Florida legalize medical aid in dying for people like me, of which there are many each year. If I look at my future and my disease and the characteristics of that disease, I see that I could be losing the ability to walk, possible loss of bowel function. I see incredible pain. I've already had a lot of pain, and I can only see down the road that could get just much worse, and no end to that pain when it gets to that time. And so eventually, if and when I got to a point where I had significant disability, I had extreme pain, and it is terminal within 6 months, I would find it very comforting to know that I have the option to say goodbye to my family, say what I'd like to say, hear what they'd like to say, and say goodbye in peace rather than bedridden and in agony, not just me, but my family as well, having to deal with that. So I hope that Florida can legalize medical aid in dying to provide an option, peace for families when they get to that point of pain and no return.